You're going to be famous. How do you feel about that? Oh, you're not so sure? Oh, we burp. Good girl. So my name is Anya Edwards, and I have been looked after by the continuity team in the Mater since I was about 32 weeks pregnant. This is my first pregnancy, and obviously with that comes a lot of anxieties, and dealing with the same team, being introduced to the same ladies really reduced my anxiety. I would suffer from health anxiety, so attending appointments would always be nerve-wracking, but coming here from 32 weeks really alleviated that. It reduced kind of anxiety. I was seeing the same familiar faces, being introduced to all the lovely girls, and everybody was so welcoming and so friendly and so nice, and just put me at ease at every appointment. I would say for first pregnancy, but I think moving forward for all pregnancies, I think it's vital to have that bond with the team that are going to be looking after you. It makes such a difference if you're going into an appointment or going into birth with familiar faces compared to strangers.
My name is Claire Graham, and I have been involved with the continuity of care midwifery team for the delivery of my baby Annie in March 2023. It was fantastic. From the first contact that I had with a midwife, it felt very thorough and very engaging, and quite. It was an empowering process because I felt like I had more choice. I felt like I had more choice because the people that I was dealing with were the same small group of people, so the care was much more involved and more intimate, so it was just generally so much more comfortable. I mean, I found pregnancy was a beautiful but a vulnerable kind of experience. You know, your body doesn't work the same way, and your mind isn't working as sharp as it used to be, and you have a lot of things on your mind, and it can be quite worrying. So, you know, having the same face and the same voice on the phone when you had questions, and the same people and coming to the same place, was just so beneficial. It just made me feel a lot safer.
So in addition to the antenatal appointments and through the induction process and the labour, I was also looked after by the continuity team postnatally for the postnatal appointments. So during like day 1, day 3, day 10, which again was lovely because you're seeing familiar faces, they get to see your baby, and you get to ask them questions. And I think, you know, because you've built that bond, you're more likely to ask questions. You know, I was maybe asking questions that might be embarrassing or might be tricky to ask if it was a stranger, but because it was people that I had seen before, it made it a lot easier.
My name is Amy Calvin. I've been working as a midwife for 8 years, and this year I have joined a new model of care called Continuity of Midwifery Care. The period leading up to the birth is often the time that women might have some worries or anxieties about. It can feel a bit daunting at times. As part of our antenatal care, we spend time with women going through a birth plan, working out and discussing what options are available and then what might be right for them. Because we are then a small team that are attending in labour, we are already aware and have worked out how to put those things in place. Sort of like a very personalised care plan for this woman that we then are well informed of prior to attending the birth. What we're trying to do with that familiar face is to try and remove a little bit of the fear surrounding birth, and by having the reassurance of a midwife that you've already met, that's the idea behind that. We know that when women feel fearful, that pain receptors are heightened, so labour can feel that wee bit harder at times. So by just simply having a face that you already know, that can all be reduced. Keep the environment nice and calm, and just help women to feel safer and more comfortable in a time where they might otherwise feel a bit more vulnerable.
I would definitely recommend coming into this model of care for your first, second, third pregnancies. It's made the second half of my pregnancy so much more enjoyable. Just put me really at ease. And I've just built this relationship now with these midwives that, you know, if we do go on to have a second baby, that I will definitely be in contact then. And hopefully I could be looked after by them again.
There's also beautiful little benefits that you get, like reflexology, and when you are pregnant, there's not a lot that you can't enjoy things the same way you used to. You have to watch what you eat. You know, you kind of, there's certain foods you're not really supposed to eat, and you kind of to navigate all those things. So things like reflexology are just lovely little add-ons that you can really benefit from, and they reduce stress. And so, you know, there's things that are available to you that aren't otherwise, and if nothing else, they're just a lovely bunch of girls to spend some time and appointment time with. So